Hi, I'm Laurie Hutcheson. I'm a 5-year survivor of lobular breast cancer, a patient advocate, and executive director of the Lobular Breast Cancer Alliance. And today I'm really excited to be speaking on the Zoom with Kathleen Moss, the volunteer coordinator of LBCA's Local Advocacy Teams, or LATs, and with Minnie Campalong and Melanie Trimble, who joined together to launch LBCA's first LAT, the Lobular Awareness Network, South Carolina. Before I turn things over to Kathleen, I want to just briefly explain how LBCA's LAT initiative came to be. We launched the idea last September. We wanted to provide opportunities for individuals with lobular breast cancer living in the same geographic area in the US to be able to connect with one another and engage in lobular breast cancer awareness raising activities and fundraising and that sort of thing together locally. LBCA is a national, fully remote organization, and there are a lot of initiatives that we embark on via Zoom. But we've always said that anyone can download LBCA's materials and share them with your local providers and your communities to spread the word about lobular breast cancer and LBCA. But we saw a real need to help support people in doing this by helping them connect with others with lobular breast cancer in their own areas, which, since there's no registry for lobular breast cancer patients, it's sometimes hard to find others like us. So we worked with our board of directors to establish this program with the charter and guidelines, and Kathleen stepped up to help become the coordinator. And this way we could offer a way for LBCA to have satellite advocacy activities all over. So I'm going to turn things over to Kathleen now. She's going to tell us about her and her motivations to take on the coordinator role. And then she's going to interview our newest LAT. Kathleen?
Thanks, Laurie. Yeah, I was just diagnosed with lobular cancer a year and a half ago, so I'm pretty new to advocacy as well. But because Laurie has been an amazing mentor to me and a guide through the advocacy process, and she recommended me to go to Project Lead last summer, I jumped in pretty quickly, and I knew from the first day of my diagnosis that I was going to be volunteering with LBCA before too long. And last fall, Laurie and I talked about all of the different potential volunteer roles open at LBCA. And this project really appealed to me because I have a lot of experience forming, training, and supervising volunteer groups. And I also really love that work. So it was kind of an easy choice out of all the different volunteer roles that I could take. This one really excited me. I love new projects as well. My lobular cancer story was very similar to many, where I went in for a mastectomy for DCIS and didn't know that I had invasive cancer until after my mastectomy. So I'm one of those advocates that really was stung pretty harshly with the news that I had lobular cancer or any invasive cancer. And so it really lit a fire under me in terms of wanting to be an advocate and now also mentoring other advocates in this journey. So meeting Melanie and Minnie was one of the first things I did in this role, and hearing their ambitious plans for their local advocacy team has been really inspiring for me. So, Melanie and Minnie, I'm just going to ask you a few questions about the formation of your LAT, your local advocacy team there in South Carolina, and you can talk about some of the ways that it's maybe unique and the place where you live. So, tell us about your connection, how you found LBCA, and your connection to ILC.
Okay, so I will start. I was diagnosed with ILC in April of 2022, and cancer was not new to me, nor was it new to my family. But what I found was the challenging way it was to find ILC. I had issues for 3 years prior to being diagnosed, and everybody kept saying, "I'm sorry, but your mammogram's coming out fine." I had lunch with my sister one day who had also had breast cancer with no knowledge of the type of breast cancer. And I had made a facial expression, and she said, "Sis, you need to go get this checked because that's how I was found." So I went to my PCP, and he did an exam, and he said, "I agree, something doesn't feel right." So he sent me for an ultrasound and MRI. So after finding that I was diagnosed with this cancer, and finding that when I was interviewing physicians for, the one that I wanted to treat me, they kept telling me that all breast cancer is treated alike. And I didn't like that answer because I'm a researcher and I like to research all of this. And also my radiologist said this was a sneaky cancer and different. So I started researching, and I went ahead and moved forward with a double mastectomy, but I knew that I was not content in the knowledge that I had. So I found the LBCA, found out about the symposium that was going to be in Pittsburgh, and went to Pittsburgh to find out everything I could from physicians, researchers, anyone who had it. I wanted as much information as possible. And at that point, I had signed up at a table to become an advocate and get involved. And Melanie had done the same. And so the symposium, you guys connected us together. And both of us being from Columbia, but finding each other in Pittsburgh. And we both are very outgoing people, and we want to help others. And we knew at that point that we wanted to help educate others about this. And as importantly as educating them, encouraging them to advocate for themselves, educating them, letting them know that they've lived in their body for ever how many years, what's right and wrong, and helping them to understand that, as we were taught, lumps and bumps are not the only way to diagnose a cancer. And so Melanie and I met a couple of times. We had the same thought processes. And so we started moving forward.
Thanks, Minnie. Melanie, tell us about how you came to this community.
Sure. I did things a little bit differently. I was diagnosed in 2021, and I had a substantial fight since my mammograms and ultrasounds were clear, and was being told, you're fat and you're menopausal, so get over it. Despite my younger sister having been diagnosed with lobular at 40, but not given the name, she just had the sneaky kind. So I knew it was serious, and I got, I pressured and pushed, and then I just avoided research and social media to a certain extent. Like, I read journal articles and didn't really want to deal with things. It was the end of COVID, and I couldn't have anyone with me at chemo. So it was a very isolating experience, and I just kind of hunkered down. But when I got through the acute phase, chemo and radiation, I felt very strongly that there needed to be more information. And so I started joining Facebook groups. And so mine is, I do a lot of volunteer coordination and doing things through Facebook. And I joined the ILC symposium group, as well as the ILC, a couple of different science-based ILC groups on Facebook. And then I just had a free space open up to go to the symposium. I was really excited. I just didn't think that I felt welcomed, and I felt like I was absolutely invited, but I was nervous because I knew it was a medical conference, and I'm a therapist. I'm not a medical person. But I was really gratified to go, and I jumped at the chance to sign up. And I was actually quite shocked how many advocates and patients were at the symposium, and it made it quite a new sort of experience for me in terms of going to conferences. So that's why. Now I do a lot of responding and supporting and reacting to people online from a science perspective and from an advocacy perspective, now that I'm kind of past the hardest part, one of the hardest parts. But I didn't feel like I could do it at the same time. And I guess I would say to others, it's not too late. If you hunkered down and got through, it's not too late to then join in efforts, after the fact, and do your research even later. I've felt glad that I've done research even since.
For sure. Yeah. So in the formation of your local advocacy team, we have had a group of others looking on, and we've called it a larger gathering called a fishbowl gathering, where folks are watching as you're forming your team. And just thank you again for letting people watch that process and learn from what you're experiencing as our first official LAT. Can you talk a little bit, maybe Minnie, back to you, talk a little bit about what some of your first steps have been and your plans for local advocacy?
So the first thing I did was reach out to media. I want the media because as we approach October, the media just starts talking about breast cancer and the fundraisers that they do for breast cancer. We have a local walk here. And so I wanted them to be aware of ILC. It's not just breast cancer, we have subtypes. So I reached out to them, and as we've gotten the brochures and everything, I'm passing those on so that we can have a conversation with the media. They can start talking about it wide range, and I have contacted several in Columbia, outside of Columbia. Mine and Melanie's goal is to cover South Carolina. So that's what we're trying to do. I have 7 meetings set up with ladies groups to get in front of them and speak, whether it be just a ladies book club or if it's a church group or whatever. So I have 7 of those meetings already ready to go. Also, I'm a realtor and I send out a magazine, and I've gotten the approval from Laurie that I can share that brochure on the back page. And so I'm reaching people through that magazine to get the information out about lobular and how important it is for us to know more every day about that. So Melanie and I are getting those brochures printed and ready to go. And we're going to do some things together. I have t-shirts being made for us with our new advocacy name. So the Lobular Awareness Network of South Carolina will be on those t-shirts. And we've got some other plans that we're working on, but our goal is to reach as many medical, media, women's groups, whoever will listen to us. That's who we're wanting to talk, educate, and help them know where to go to get the information they need from the LBCA.
Yeah.
Those are some bold plans. Do you have anything to add, Melanie?
I just would add, I think we have, we don't live in a big city, and we are so in between. You know, you can drive 4 hours in either direction and get to Duke or Emory, but this whole, you know, South Carolina kind of suffers from being in between. And so even though Columbia is not the tiniest town, you know, it's a small city, people think of this as a kind of rural area, and we know we're kind of resource low, I guess, on some level. And so I come at this with the sense that from all the volunteer and grassroots work that I've done in the past, to get the word out to people in smaller communities, you have to show up. It's harder to do it online. There's not a great internet a lot of places, but just the act of actually going and showing up to a women's group in a small town or to a church group in a small town, the act of showing up lends a certain amount of credibility and trust because of the effort that's been made. So I think that both of us come at it from that, and just having to adjust to like less internet options. You know, people's internet can be kind of sketchy. So that's a thing that we've discovered might be a little different than some folks who have a bit more of an urban center that they're living in. And then I wanted to say, like, having the groups, it's been funny to be first because I think it's hard to be first, you know. It's like a lot of deciding and committees and feeling like we don't even know what would be the best thing. But it's been helpful to see these groups of interested people all get together, because I think some of their ideas have really struck me, and I think that there's an element of brainstorming. And since the people in that group who want to start these teams come from such different backgrounds, we all kind of bring little pieces and ideas that are complementary. It's not like it's a whole bunch of nurses and no one else. And like with kind of one way of doing things, there's so much variety in the people participating. That's been really helpful to me.
If I can just jump in and thank you both and reinforce that there's power in being there in person. And that's something that we haven't been able to achieve. And it's been very interesting and difficult to reach by email and all of the mail that we've sent out to various breast oncology programs. And it's really going to be, I think, through showing up, as you're talking about, and having some power in numbers, that we're going to get the point across that providers need to be telling their patients about lobular and about the fact that there's information out there they can refer people to, and a community. And that's something we've had a hard time getting through from, you know, the high national virtual level. So thank you for going first.
Yeah. So going back to you, Minnie, Melanie talked a little bit about how the larger group has helped the formation of your LAT, your local advocacy team. Can you think of anything else that's helped the formation process?
I think the support that you and Laurie have given us throughout and the information that we saw at the symposium. And, you know, my first recommendation is if you financially can go to one of these symposiums, a lot of it may be over your head because it's a scientist or a physician talking about it. But the number of people that you meet that have ILC, and you kind of get the encouragement to move forward, to realize that we're not common. Okay, our breast cancer is not common. And so I think that helps to push me, and listening to so many people that's on our group talks and calls whenever we do it, and then staying in touch with people that are from not in our own state, but just listening to their stories and their challenges helps me to want to dig in deeper and harder. And as I said earlier, I'm not new to cancer. I've had cancer previously. My family has cancer throughout it. And so for me, it's always been about helping anyone with cancer to learn how to do more. I have an immune deficiency called hypogamic globulin. My son had a group B strep. And so I've been on advocacy teams for both of those. And being, as Melanie mentioned, in our smaller city, a lot of times the doctors don't have knowledge of it. They know there's the subtypes, but you know, doctors today spend a lot of time with patients and don't necessarily have the time to go do the training elsewhere to do it, to go for a weekend or during the week. And so I feel like if we can bring that, as you guys encourage us to get in front of those doctors and hospital systems, I think that is also empowering us to push forward.
Thank you for being willing to do that. That is a tall order for a lot of volunteer advocates, and you are really blazing the trail for some of the others that are watching as you progress and experiment and take these resources out into the world. Going back to you, Melanie, can you talk about how this new volunteer role is fitting into your weekly, daily life? How many hours a week, and how do you negotiate it in terms of flexibility?
Yeah, I'm making a switch from education to therapy. So I go back and forth, which allows me to have my own schedule. So it was really important. I worked full time the whole time I was in treatment. People can probably relate. I was afraid of losing my health care. And I had a job that didn't have sick leave. So that was really exciting. And so I've taken some time to myself and really thought about whether this is a part of my work going forward. So I'm trying to craft a way to work full time with a carve out for things that I feel are important that don't pay. And this would be one of those. So in the same way that some of us do pro bono therapy clients, just to like balance out the scales. So I haven't been putting a huge amount because it's been formation. We have like ideas. We maybe maybe an hour a week at this point, thinking of ideas or talking to people about it. I anticipate it'll be less of a weekly thing and more of an ebb and flow. If we're going out, we might set aside a couple of days and try to hit a few places or something like that if we're going out into the field and plan those, a month in advance. So I think it'll be doable in terms of planning forward and kind of clumping work at certain instances. Maybe there's a quarterly clump that I get done in a couple of days, and I'm not trying to sort of stuff it in every week so I don't get too scattered. That's my vision of how this might work, since a lot of what we anticipate will be sort of one-off events, going to a group or going to see a medical practice or something.
Sounds good. Do you have anything to add, Minnie, in terms of your perspective and how this is fitting into your week?
Being a realtor, I have a lot of flexibility, and so again, I choose the important things in life that I want to add in. I've not always been great at that, but this is very important to me, and this is where I want to spend my time. And so I may do a little bit every day. Some days I may not get to it, but I add it on to something else. It's not like I can sit here and say I spend an hour. So I may spend 10 minutes at this point and an hour later. So again, I think it's as we're growing, we will know better about how much time we spend. And I think the time comes down to how aggressive we want to be in spreading the news and getting that word out and getting the information to everyone, and how many people are going to be receptive to letting us come in.
Absolutely. Yeah, we've tried to underline how much this is really you guiding the process and setting the speed and the tempo of all of your activities. And so every let is going to look a little different for that reason. So we meet monthly in our larger fishbowl meeting, and we've described in the last couple of meetings how these different lets, these local advocacy teams, are going to look very different and come together differently. Some will form slowly, some will form quickly, like you have, and then others might not form a formal team at all. Um, but you really jumped at the chance to make a connection and to be representatives of LBCA out there in the world. And so I just wanted to ask, what kind of advantages do you see to becoming a formal let instead of maybe a slower growing informal let in your community?
I believe it allows us, and people take us as being a more respectable um, individual to come in and talk about it. We're not someone just off the street. We have an organization backing us with the information and with what we're doing. So it's not like we're just walking in informally without all the appropriate literature and a place that we can guide people. And I think being a part of the LBCA creates that identity for us to get us through the door.
How about
I
you,
think
Melanie?
I kind of think it's actually maybe an advantage of being in a small city. It's a small enough system, right? So that we both have Minnie and I have networks, over decades, and they reach very far into the system. And then also there's a casualness. Like I had just a casual conversation with my breast surgeon at a checkup, and I go every 6 months. And I just kind of said, oh, and by the way, because I've been a little bit of a hassle for him. Like I ask a lot of questions. And so we have kind of a joking relationship, because I had to convince him for certain things. Like I wanted to go flat, and it was almost an argument. And he's been educated by me already a couple times, and respectfully. But having the ability to say, oh, and by the way, I'm doing this volunteer stuff with a national organization about this kind of thing. He heard that, and he understood that it was a legitimate organization. And he just immediately, just right in that moment, said, I'll be happy to come speak anywhere you want me to. And that is not unusual in this size environment. I think that people in bigger cities or with big cancer centers get hit up a great deal more for that sort of thing, or aren't used to having it be quite so word of mouth or relationship based. And that can be a bit of an advantage. So just adding on, like, there's a national organization with this research page and newsletters, and it's very legitimate and science based. That's just sort of boosting that and making it seem more concrete for those folks.
Yeah, that's so great. One thing that kind of stands out to us about your team and your goals and ambitions for your LAT is that you're focused on educational advocacy. So you're out there not just building awareness and visibility, but you're actually hoping to educate the public. What have you learned about doing that kind of advocacy around education so far? I know it's been a very short time, but what have you learned so far, Minnie?
Um, I feel like people are amazed that we have the information that we do. But they do, for me, I do love educating. And so this is what I've done for many years. When I was working with the CDC for the Group B strep, it was about educating, getting as much information out there as possible, and then being there to rebound if they have a question I can guide them to the right place. So it's not that I have the scientific background or the research background. I'm not medical, so I don't want to give them inaccurate information, even if it's something I've read and I know that it's to be factual. I prefer to send them or hand them the brochure that educates them all the way through. And so that's what's so advantageous to me, to be able to have the literature and the facts from you guys. And even when I do my presentation, my PowerPoint has the slides that have that information.
So great. How about you, Melanie? Do you have anything to add?
Well, it's funny that we're both educators. I was an actual drama teacher in an elementary school for 8 years and then a fine arts school for a couple of years. But also I've tended to do community-based work even in my mental health career. So for example, things like finding new ways to reach communities in northern New Jersey after 9/11 that were immigrants, where they were terrified and hiding, right? So like how do we find the connection to those communities? How do we find bilingual support and people to work with? So I'm used to sort of a community approach. And I think and I'm also not afraid of trying to explain what I do know and knowing my limits. So I have had to, in my career, find ways to explain complicated things in layperson's terms. I'm not going to try to explain molecular biological research from the symposium, right? Like I'm not there, but I can explain the difference a little bit for a layperson between different medications that might be described to them and they're confused, and point them to a place to find it. And so I feel pretty comfortable with that sort of stuff because of that past as an educator. And I think both Minnie and I feel really comfortable that we can talk to anybody. Like I can get into lobular conversations at the Trader Joe's checkout counter. If someone's interested and asks me one question, I'm ready to go. So we both have that about us too. So I think that's helpful.
Yeah. Yeah, we always talk about how it's very simple to start advocating because all you have to do is tell your story. And LBCA has all of the literature that you could ever want when you're done telling your story about the scientific facts and what we know so far. And of course, we're always learning and it's always changing. It's really easy to just grab another person in your community and start a local advocacy team if people want to do that. What would you say to someone, Minnie, who wants to start a local advocacy team and wants to get rolling right away, like you two did, and are eager to get going? Do you have any advice for them?
Don't hesitate, jump in with everything you have. For me, if this is near and dear to your heart, don't hesitate. That's the biggest thing I can say.
And Melanie, do you have any advice or would you just echo that?
Yeah, I think it's tough that sometimes people can be very private, and I have people who want to help and who are willing to print things for us or who would go with me to something, but, aren't survivors. And then I think there's some people around here that I know that are survivors of breast cancer and don't want to really publicly state that. And so I think there are ways to be private and also help with the work if you feel so called. And so I know our stories are really important, but I do think there's a role for those who don't feel comfortable yet explaining that. And I hope that there's also, to be truthful, I had a really cute conversation with one of the members who's thinking of making a LAT, who's in West Virginia, which has an equivalently rural sort of situation. And I hope that there's a way that I like to road trip. I hope there's a way that sometimes those of us who are interested, even if one's a formal LAT and one's only one person, I hope there's just a lot of exchange and cross-pollination, and that we can make room for people who are maybe not ready to tell their story but want to help in some way, and people who are partners of ours that want to help in some way and aren't the survivor themselves. I think this will just expand.
Absolutely. Thank you for pointing out that there are private ways to advocate. I can see lots of ways for, even if the whole group wanted to stay private in their area, just going back to the clinical setting and offering literature there, and then doing, advocacy around patient awareness. There's so many patients that have been already diagnosed with lobular who would like to have support and know more and just be pointed to the LBCA. So there are little ways. We don't have to spend hours and hours doing advocacy. So there are different ways to do this work without being public. Is there anything that I haven't asked that you came today wanting to share with the world about your experience? Minnie, would you like to share anything else?
So I will say that with what Melanie said, we don't always have to tell our story. When I was not quite ready to tell my story, I just would always start a conversation saying, "Hey, were you trained any differently for a breast exam than feeling for lumps and bumps?" And of course, I always hear no. That's the only thing I feel for. And I'll go, "Have you heard of?" And then we start the conversation about ILC without me having to tell my story or telling as much or as little as I felt comfortable with at the time. And so I just think it's about telling a story. It may not have to be our story. It could be a story as much as just a self breast exam. I think it goes back to, we all know our bodies. As I was telling a lady not too long ago, I'm 60 years old. I know my body more than any doctor or anyone else. If there's something there that I know should not be there, then it's my job to push a doctor to get there to listen to me and to do the research and help me find that situation.
Thank you for that. How about you, Melanie?
I think I just want to say there were times during this when I have felt enormous frustration with the medical situation, with having not a comprehensive cancer center in my state, and different things. And I'm a pretty privileged person who could try to take time off and who could, drive. I have teenage kids, not toddlers. I already was coming at it with a lot of help, in a certain way. And so I just want to validate the feelings of frustration that it's possible to have when you have something unusual or when you don't feel like you're being listened to. And then say, I think this is the only way to change that. And that I hope all of these efforts push upward a lot. I'm a systems thinker. And I know, all the oncologists in our town are generalists. They're not even breast cancer specialists, right? So they can't go to 40 conferences a year. We're not willing to pay them enough to go to 40 conferences a year. Insurance isn't. They're just as stuck in a way. So I hope that by getting information out and having more and more questions and teaching people to question other things in the healthcare facilities, we can help the doctors and be kind-hearted towards the medical staff to push upward and ask for better dissemination of information or more room for future trainings and more access to continuing ed or specializations. I just feel like we can maybe push upward and help the medical profession actually expand and get better about this as well.
Thank you for being so ambitious in your goal to do that. And that's such an amazing example to set for other advocates. I'm so glad that the two of you found each other last fall at the ILC Symposium and hit it off. And I'm so excited to hear what you do together. And I hope that we'll do another check-in like this and hear about your stories maybe a year from now.
Thank you.
And I want to thank you as well. We're so excited to be part of your launch to raise awareness of lobular breast cancer in South Carolina. And as you were talking, I was thinking, gotta send them pins, gotta make sure you have stuff that makes people curious, like what is that? And also our signs and symptoms one pager, because I really feel like we're partly on a mission to distribute that as well. It's not just about a self-exam feeling for a lump. So thank you so much for talking to us today and for moving forward on that. I also look forward to hearing back from how it's going, and I know I'll be in touch. And I know that we're going to be working on big plans for this coming October. Before we end, I want to tell everyone who's interested in learning more about the local advocacy teams about how to get involved. You can email Kathleen, and I'm going to share my screen if I can figure out to do this. You can email Kathleen at lbca.org. But